In the sedating location, among the first things to do, and very important, is to check the availability and the functional status of the standard equipment. First, the oxygen wall sources. You'll notice that the Ambu bag here is hooked up to a standard wall source without a Christmas tree adapter because it fits on very nicely there. And we have two wall sources, and that'll be helpful for our demonstration. And this is a standard wall vacuum. And you can see that's turned on here, and it has an adjustable ability here to a maximum suction here in the red zone this way. You should always check to make sure this equipment is present and functioning.
Sedating locations are located in many places throughout a given facility. However, all sedating locations share certain things in common. Among the most important and unfortunately often overlooked issues is sufficient space and sufficient ambient light. Any sedating location must provide an oxygen source capable of 50 pounds per square inch, because supplemental oxygen is recommended for most patients undergoing sedation.
Among the simplest things that we do for most patients being sedated is to provide some supplemental oxygen, and the simplest way to do that is with nasal prongs. So we'll attach the oxygen to our wall source, dial up about 3 liters, because much more than that will feel breezy to the patient and make them uncomfortable. And bear in mind that there are some limitations to this device in that even when properly placed, and here in the nostrils, secured behind the ears, brought snug tight, you're only delivering about 40% oxygen to the alveoli. So this is a good thing to do, but by no means does it provide 100% oxygen to the lungs. For patients who need a truly enriched oxygen mixture, the non-rebreather bag and mask is the best way to do that. And again, we'll hook up to the wall source.
The liter flow of a non-rebreather bag should be adjusted so the reservoir bag is filled. Oxygen flow rate should be 10 liters per minute to achieve greater than 80% FiO2 and 15 liters per minute to achieve greater than 90% FiO2. The use of an Ambu bag to create a tight seal around the patient's mouth tends to be necessary to achieve this.
We'll place this carefully over the patient's nose and mouth and bring the head strap behind, making sure that we leave room for the bag to be filled, because this functions only effectively when the bag is filled with oxygen, patient breathes from the bag, and exhaled gas goes out these ports by the side of the nose. In this way, we can deliver 100% oxygen to the alveoli.
Sedating locations also provide a variable power vacuum suction apparatus. Wall oxygen and suction sources are most reliable and preferred. When tank oxygen or portable suction machines must be used, the attending physician must ascertain that the oxygen supply is sufficient and the suction apparatus is functioning properly. The medical record must note this before the procedure begins. A sedating location must include a standard, fully equipped cardiac arrest cart, called a code cart, with equipment appropriate for the age of the patient being sedated.
The cart must include a self-inflating positive pressure oxygen delivery resuscitation bag, sometimes called an Ambu bag, airways, laryngoscopes, and endotracheal tubes. Additionally, a full supply of resuscitation drugs must be available, including narcotic and benzodiazepine antagonist drugs, naloxone, and flumazenil.
A sedating location must also provide a pulse oximeter with alarm, a physiologic monitor, including a non-invasive blood pressure monitoring device, EKG, and temperature, and a patent intravenous infusion for both the duration of the procedure and during the patient's recovery if necessary. The American Society of Anesthesiology recently added the use of an end-tidal CO2 monitor to their moderate sedation guidelines as a best practice to help identify respiratory distress.
This is an example of the typical monitor that we use for monitoring physiologic function during sedating event. The advantage of this particular monitor is it's lightweight, portable, and very rugged, and it has the ability to monitor simultaneously the 3 important parameters. Most importantly, pulse oximetry with oxygen saturation, non-invasive blood pressure, and for patients who require it, electrocardiogram monitoring. A word about pulse oximetry. It's very important that you have the right size sensor. This is a disposable sensor, and this happens to be the standard adult version, but these are arranged in size from the average adult to the smallest premature baby, and they must be fitted appropriately for age.
All this equipment is prepared and maintained according to existing hospital protocol developed by the Department of Biomedical Engineering and the Cardiac Arrest Committee.
Now that we've attended to all these details, we're ready to move to the actual sedation procedure for the patient.